Hi, it's Ms. Schleiss, and we're going to look at the personal characteristics of healthcare workers, and for the most part, workers in general, but of course, we're going to focus on healthcare workers. And there is a worksheet that you should be following along with this video, and you can pause as needed while you're answering those questions, or you can have those questions on your own sheet of paper, so make sure you've gotten that worksheet downloaded from Edsby or copy those questions onto your own paper. All right, so first I want you to think about some personal traits a healthcare worker should have, and that was the Edsby post that I posted on Friday. If you haven't answered that, make sure you go and answer that as well. So think about those things, and not your actual skills like taking blood pressure or the education that you've gone through, but those ways and behaviors a healthcare worker should have or should act in. All right, so now we're going to look at those desirable traits or qualities of a healthcare worker. So all healthcare workers must be committed to developing certain personality traits. A desirable trait for healthcare workers include these general mindsets. So these are the desirable traits you should be listing on your worksheet. You need to maintain a positive attitude. You should be following the rules. You should be able to communicate effectively, interacting appropriately with your patients or with your fellow healthcare workers. And you need to be able to grow personally and professionally. And we're going to talk about each of these things. All right, so the first one is a positive attitude. A positive attitude or the spirit is contagious. So if you have a positive attitude, it will spread more likely through the rest of your coworkers and patients. And it can create a more pleasant environment for the patients and the coworkers to work in. So to create a positive attitude, you must develop the traits listed on here of flexibility, honesty, responsibility, commitment, and enthusiasm. So think about, what does it mean to be flexible? I think most of the other ones make sense. Honesty, telling the truth, responsibility, being responsible for your own actions, doing what needs to be done, commitment, so working hard and being not changing jobs frequently, and being happy and enthusiastic about where you are. But what does it mean to be flexible? We're going to look at that on the next slide here. So one of the most important things is to be flexible above all other traits. So you must be flexible. Medical facilities and jobs are always changing. Healthcare workers must demonstrate the ability to adapt to that change and learn new skills and try different delivery methods. We've talked briefly about CEUs, or continuing education units, which are just like they sound, continuing your education after you've been certified or finished your schooling, because healthcare changes all the time. You don't want a doctor who became a doctor 50 years ago to be still practicing and doing things the same way we did them 50 years ago, because technology and medicine has changed. We've learned a lot of new things. So a healthcare worker must be able to change with that. For example, it's kind of showing here on the picture. This is it. This guy's been a nurse for many years. He began working as a nurse. A mercury thermometer, which is this one here, was a primary tool used for taking temperature. However, the healthcare facility he works now uses only electronic thermometers. So something like this that we've used in class, or even an infrared thermometer or a temporal scanner, whatever they have changed to. You must be flexible and adapt to this change and learn the way, be willing to learn the new way to do the procedure and operating the new piece of equipment. So that's a basic example, but there's many things that have changed. All right, in addition to following the rules, maintaining a positive attitude is another desirable trait for healthcare workers. Healthcare workers must comply with the rules to the facility where they are employed at. This means following attendance policies, arriving to work on time, wearing the appropriate dress or clothing or uniform, adhering to the line of authority, so making sure you're reporting to the person above you and you're not going over their head all the time to a more advanced person in the organization. Performing only the tasks in your scope of practice. So if you are a nurse, you might be able to give an injection, but you can only give that if the doctor has told you to. You cannot diagnose and decide the medication to give for that patient. That would be within the scope of practice. And obeying all general rules, guidelines, and standards for your place of work. All right, interaction. So when healthcare workers interact with patients and workers, they must be professional and appropriate at all times. This involves being respectful of all people. Healthcare workers must never be judgmental of a person's ethnicity, culture, age, gender, religion, lifestyle, or economic status. Instead, these differences should be valued, and you can't treat someone differently because of a difference. In addition, healthcare workers are often required to interact in various settings. Sometimes interaction may be in a one-on-one setting with just the patient and that healthcare professional, and other times it may be a group setting where you might have other family members and other healthcare professionals in an area with a patient where you must interact. So the healthcare worker must learn to act appropriately in each situation. All right, so now you are going to be assessing your skills. Again, on the worksheet, there are these questions. Some of these questions are posed on the worksheet for you to answer. You can type that in on the worksheet or do it on your own paper. And you need to use complete sentences to describe your communication skills. So these are questions that a lot of times are asked during an interview. So now is a good time to think about your responses. And if you put them in a complete sentence, that means that's how you could answer it during an interview question. So if you are asked, is communication one of your strengths or weaknesses? And give an example of that. You could be asked that way, or you could be asked something like, tell me one of your strengths or tell me one of your weaknesses. And then you could use communication as an example of either a strength or a weakness, depending on what you think it is. And in your example, you should be using a real life situation of how you've communicated really well with someone or how you have not, and how you could have done it better for your example. That could be, again, in school, in a personal setting, or in like a work type setting. All right, and then next you are going to describe your ability to interact with people on a one-on-one setting and a group setting. So you're going to answer which type of interaction is more comfortable for you, interacting with someone one-on-one or in a group setting, and explain that or give an example. And then finally, describe ways that you might improve your communication skills. So what are some things that you can do? And this might be something you might want to look up online and get some examples of ways to improve your communication skills, and find something maybe that you're not doing that you could try to do in the future to improve those skills. All right, once you've analyzed your communication, we're going to look at your professional and personal growth. So we've done an activity earlier in the year on goal setting. We're not going to do it full out this time, but I do want you to set goals. In the healthcare industry, since it's always changing and you need to grow professionally and personally, one way to monitor your growth is to set goals and then, try to achieve those goals. So they can be short or long term. A long-term goal is achievable that may take a few years or even a lifetime to accomplish. Short-term goals are the smaller steps taken to help you achieve those long-term goals. A short-term goal may be only a few days or weeks or months to accomplish. So one of your short-term goals could be what's going to happen maybe in the next school year. What courses are you going to take? What type of grades are you going to get, since the school year is pretty much over? And then what are you going to do by the end of high school? And then where are you going to be going after high school to continue your education to help you achieve that goal, your professional goal in 20 years from now? So think about what kind of education is needed and training, what personality traits or characteristics you might be required. So should you join some organizations and clubs that help you gain leadership skills? Think about HOSA for next year that helps you gain some of those skills that are great for looking for jobs and for colleges in the future. What kind of problems could prevent you from achieving your goals? So what can you do to overcome those problems? And what smaller steps now can you take now to help you achieve your goals? So the final thing on the worksheet is to write a long-term goal that you have for your life, for your profession. So example, in 20 years from now, so depending on your age, when you are 35-ish, what do you want to be doing as a professional? And by then, anybody should be into their profession for the most part. If you're planning to be a doctor by then, you would be working on that, or you may have been doing it for a pretty long time, your profession, depending on how much schooling it takes. So that would be your long-term goal, somewhere around 20 years from now. And then you're going to list 3 short-term goals that will help you achieve that long-term goal. So think about 5 years from now, you could do, what do you want to be doing next year in school as a sophomore? And then once you've graduated high school, in about 5 years from now, where do you want to be? And then in 10 years from now, then when do you want it to be? That should be when you're about entering into your profession, depending on what your profession is that you've chosen. You should already be in it by 10 years, give or take a few. So those are the things that you need to think about for your goal setting. So once you have completed that, you will go ahead and submit this worksheet to EDSB, either the picture that you hand wrote or your typed worksheet. Please let me know if you have any questions, and all right, hope you have fun kind of looking at your skills with this. Bye.